We're going to give you a medical education this morning because we're very happy to have 3 providers with Erlanger Health Systems on the show with us this morning. It happens to be Advanced Practice Providers Appreciation Week, or just week.
Yeah.
I'm looking to Leslie Turner. She's a nurse practitioner with Erlanger. Next to her is Hadley Eubanks. She is a midwife with the hospital system. And then behind them is Benjamin Oliver. He's the physician's assistant on the show with us this morning. Good to have you all 3.
It's good to be here.
So Erlanger, you were telling me, Leslie, is really proud
Yes.
of the statistics. You've got quite a number of these APPs.
Yes, that is correct. We, a few years ago, they kind of adopted the kind of nomenclature of advanced practice provider as an umbrella term to represent all of us who have decided to go into more of advanced practice in our field. So it encompasses nurse practitioners, midwives like Hadley, physician's assistants like Ben, and even CRNAs, which we don't have a CRNA with us today, but we're very pleased and proud to have a lot of CRNAs that practice at Erlanger, and they of course do anesthesia for us in the OR. We have about 262 APPs on staff at Erlanger employed, and then we have probably in the neighborhood of 560 that are credentialed and privileged to practice, such as our CRNA peers.
It's important for us as patients to understand more what these designations are for you each, because often you're the ones we're seeing first.
Right.
Is that right? So Ben, as a PA, you were telling me you began in the lab and then you made this switch to advance your career.
That is correct. So with PAs, it just varies in terms of where you might start. So you could be in various stages of medical care. So you might have been a paramedic, or you might have been a nurse, or you might have been in a lab like I was. But you do further training to kind of get greater medical knowledge to help with diagnosing and treating, and then even prescribing medications for patients.
So your program is a little bit better than 2 years, right? Where you're totally immersed. You can, though, get a fellowship as a PA, and then you can really specialize in a certain area if you wish.
That is correct. And sometimes you're able to go into some of these specialties even without the fellowship, but now we're learning some of those fellowships help a little bit with the confidence in these specialty areas.
Okay, so then your role as the nurse practitioner, how does it differ from his?
So we both are taught how to manage patients, so that in itself is pretty similar. Nurse practitioners are taught on the nursing model, which is a more holistic approach to care. We basically become generalists as nurses when we go to nursing school, so meaning you can kind of go in and do anything, L&D, you can be a school nurse, you can work in a doctor's office or the hospital, but then when you decide to go back and advance your practice, you pick a specialty that you want to focus on. So it may be midwifery like Hadley, or it could be acute care, managing people that are in the hospital, or primary care where you're in more of a doctor's office setting.
Okay, I'm very interested. We had a conversation already before the cameras turned on about the almost contradictory terms of a hospital having a midwife, but Erlanger does this, right?
Yes, ma'am. So I am what's called a certified nurse midwife, meaning that I have trained in similar to a nurse practitioner system, except I specialize in obstetric and gynecologic care, and I get to attend births. There are women's health nurse practitioners that also do obstetric and gynecological care, but they don't attend births. And then there are also different types of midwives as well. There are midwives out within the community, like registered midwives or community midwives, but as a certified nurse midwife, I function in the hospital.
So, you know, where with Leslie and Ben, most of the time you're either going for a scheduled appointment or there's an acute need that calls on you to see one of them. In your case, are you seeing women over the course of the pregnancy?
Yes, ma'am. I'm actually seeing women over the course of an entire lifetime. So essentially, whenever somebody starts their period, they can come in and see me, and we can talk about birth control options to help manage painful periods, lifestyle changes, all the way up to menopause throughout an entire lifetime.
So is it just a different approach from a traditional medical doctor? As a midwife?
Yes, ma'am, it is. So a little different there between the medical model of care versus the nursing model of care. Nursing model of care, like Leslie was alluding to, focuses more on holistic approach, looking at the entire body, mind, body, soul, and looking at health promotion and disease prevention is a key essential part to our
Okay, before I let you off the hook here, so you are in the labor and delivery room. right?
ma'am.
And that's happening at the hospital. You're not doing home births, you're doing hospital births.
Correct.
But then is that a comfort to the parents, because if there is a problem, you've got the support of the hospital right there?
Yes, ma'am. That is a very big difference. So thankfully, in most cases, I am able to attend deliveries without any issue. But if an issue were to arrive, I have a laborist who is a hospital provider right down the hallway, and if something were to make a sudden change, we can make that sudden change in real time and get everybody on the other side of the birth safe and sound.
From the consumer side of this, it's really beneficial to all of us to see this growth and the continuation of this specialty, right?
Yes, it's. I think the role of the physician is vastly important. We cannot do our jobs without our physician colleagues. They are great collaborators for us in how we manage patient care. I don't see that going away, but I know that there are shortages for physicians coming into certain fields, such as primary care, and so for myself, working in a primary care setting, it's been very helpful to see the role grow. And then, of course, on the inpatient hospital side and even on the women's health side, it just continues to grow. We have people living longer and we have more people to take care of. And so allowing for us to come alongside our physician peers and really partner with them in inpatient care has been great.
And Ben, I'll throw the last question to you, but if you're making an appointment and you're thinking, oh, I want to see Dr. Such and Such, and the rule in the office is, well, first you see a PA and then on, that's actually a benefit to the patient, right? Because maybe what they're dealing with is enough to not need to pass on along to the doctor.
That is correct. And just kind of to piggyback off of what Leslie was talking about, just the demands of healthcare are increasing, but the bandwidth with the providers may not be as strong in terms of the physicians being pulled in various directions. So being able to have APPs in various parts of the medical field also kind of helped extend that.
Well, we were happy to help celebrate you this week, so
Thank
thanks
you.
for coming our way.
We appreciate you having us.
And now you know the next time you make an appointment, the credentials of who you're having that appointment with. You can always find more at erlanger.org, and there's their phone number. Thank you all three.
Thank you.
Thank you.
Don't go extinct like the dinosaurs.